Good morning, ladies and gentlemen, all our eminent personalities here present. I welcome you to this edition of...
Good morning, ma'am.
I welcome you to this edition of the annual C-HELP Health Summit. This year's edition, as we've always done, we are having it in collaboration with the Medical Women Association of Nigeria, Kaduna State chapter. That chapter is ably led by the eminent personality, Dr. Zainab Paru Mohammed Idris. And I want to appreciate her and her team of, her leadership team, and also all the members of M1 for the opportunity to partner with them to bring us this awesome summit. Like was alluded to at the beginning, this is the 5th edition of this health summit. I'm so excited because I can't believe that 5 years have already gone by, and with each passing year, we've been improving upon the mandate that we have to serve our people through our platform. And we appreciate the Medical Women Association, we appreciate members of C-HELP, particularly the volunteer community, for all the awesome work they've been doing to bring this summit to fruition today. This morning, we have in the house some erudite personalities that will be taking us through what this summit is all about. And first, well, in no particular order, the first person that will be speaking to us this morning is Dr. Zainab Mohammed Idris, and she's going to be our keynote speaker this morning, trying her best to give us an idea into the theme of this year's summit. And we also have Dr. Otene Samuel, who is a consultant oncologist. Is going to be talking to us about cancers, particularly this month of October is the month that has been dedicated to breast cancer. So he's going to be talking to us about cancer vis-a-vis in the context of the theme for this year's theme, which is rebranding the Nigerian health system towards and within a new Nigeria of our collective dream. Coming up right after him will be Dr. Kajobola, who is the Chief Medical Director and also the Head of Radiology in the ASI Ukpo Diagnostic Comprehensive Center, Calabar. The center is doing a very fantastic job in bridging the cancer care gap in Nigeria. And so we take great delight in spotlighting it during this health summit. Also, you'll be hearing from our dear professor who has been doing a lot trying to impact the medical world through research, Professor Ahmed Mohammed, a professor of urologist, and also the editor-in-chief of Journal of Medical and Basic Scientific Research, which is also a journal, which is also the journal arm of C-HELP Nigeria. Then, of course, we have Dr. Ridwan, who will be joining us all the way from the USA, hopefully, because we've been having some technical challenges. So we are still very hopeful that he'll be able to join us as we go along. And of course, Tembu Mona, who is the founder and CEO of Archival Clinical Research Community. She's going to be joining us also and talking to us about research. So the theme for this fifth edition of the Health Summit is rebranding the Nigerian health system towards and within a new Nigeria of our collective dream. You can all agree with me that we all desire a new Nigeria that works, a new Nigeria that takes our desires into consideration, a new Nigeria that caters to our needs, a new Nigeria that we are proud of. And so within this new Nigeria, we desire that we have a health system that functions optimally and also at the same level with what obtains in developed clients. You might want to ask, what exactly is rebranding? When we say rebranding simply means to change the corporate image of an organization or a company. In this particular case, to change the image of the Nigerian health system, not just in perception now, but in actual, in practice, in action, in doings, in its doings, to change the image. And of course, it is the creation of a new look and feel for an established product or company. In this situation, the Nigerian health system, we all agree, has, even though it's been trying, but there are so many areas whereby it needs to be rebranded. So that is what this health summit is all about. It's going to be a discourse. We're going to look at the different areas, cancer care. We're going to be looking at research. How do we rebrand these areas to bring about better impact, more fulfillment for our people? And it's going to be interactive. Hopefully, when our erudite speakers talk to us, we're going to be entertaining some question sessions so that you can bring to the fore some of the troubles that we've had, some of the areas of pain that we have concerning the Nigerian health system, and see how we can collectively make the Nigerian health system better. What exactly is the goal of rebranding? The usual goal of rebranding is to influence a customer's perception about a product or service or the company overall by revitalizing the brand and making it seem more modern and relevant to the customer's needs. So we have our needs as Nigerians, health needs. Many of us, it is no longer news that many of us who can afford go abroad to seek treatment. And of course, it is no longer news that the top echelon of the society hardly patronize the homegrown Nigerian health facilities. So those are some of the things we want to change. We want to create a Nigerian health system that will be able to provide the cutting-edge services that people go abroad to seek. We want to discuss, we want to find a way to groom and to develop our own local health facilities that our people will be proud of, that our people will feel safe within, people will be able to go into and assess the level of care that is obtainable outside this nation. It is usually a long and challenging process and should be done only for the right reasons. And for the Nigerian patient to be able to get the best medical care possible at home, I think it's a good enough reason, it's a good enough motivation for all of us to join hands together and discuss and find lasting ways to be able to bring the health system of our dreams to Nigerians. The truth of the matter is that right now, brain drain is being experienced in the health sector. It's not a palatable situation. People are going. You have no moral right to stop the people that are going. Many people are going for a number of reasons. It could be economic reasons, it could be the desire to have that satisfaction to serve. Many people that are doctors, that are nurses, that are in the healthcare system, they are people that are passionate about what they do. Now, it's so painful when you are in a place and you cannot give your best to that community because you are being handicapped by lack of facilities or environment that does not support the work that you do. So many people are leaving for a number of these reasons, and then we cannot stop them. But we can decide, we can look inward and decide that as a nation, we can rebrand our health system so that our people, our specialists will be happy to stay at home and serve. It will shock you to know that actually in pockets of Nigeria, there are people already that have determined that they will stay in Nigeria and make things better. Some of them, many of them were trained at home and then abroad, and then they came back here and they are serving. There are so many of them that you will not know about. But C-Help has a mandate to know these people, to know these facilities, and to bring them to the attention of Nigerians. And many of them are doing wonderfully well. So our target with this health summit today is to begin to put the flashlight on areas where people are already rebranding on their own, and then see how we can make it a collective thing so that we can move Nigeria forward. If you go to places like Lagos, people are doing great things, but many of our Nigerians are not aware of those people, and so they go outside to seek for services that are already domiciled in Nigeria. Even in the government hospitals, in the last few years, I think there's a new crop of CMDs, chief medical directors, that have come on board, and they are doing fantastic things across board. If you go to Abuja, the story is the same. Great things happening. Some of these people need to be applauded. If you go to Zaria, if you go to Lagos, great things happening, but they need to be applauded, they need to be encouraged, and then we need to build on the things that they are doing so that more people can buy into the dream, and then we consolidate on what we are doing so far. Not too long ago, the news of His Excellency, the Vice President of Nigeria, of the Federal Republic of Nigeria, Professor Yemi Osinbajo, flitted into the Nigerian community that he had a surgery in a private institution in Nigeria. That was a great moment for many of us because it was like an affirmation on the health system in Nigeria. We welcomed it, we applauded him, and I think he still needs to be applauded because what he simply did was to endorse the Nigeria health system. And hopefully, in the not too distant future, we would love very much to have His Excellency to speak to us on a platform like this about his experience in a Nigerian hospital. I believe that would go a long way to improve the morale of those at home that are working tirelessly to raise the image of the Nigerian health system. We have a lot of hands. We have people that can work. We have people that can deliver. We have people that know their job and they are passionate, but most of the time they are handicapped by lack of equipment, lack of facilities, and also working conditions are not always optimal. And of course, economic situations are not always favorable. Many of these people have dependents, but of course, you don't have enough to cater to the needs of your dependents. So you may have to think of going to bring other clients that appreciate the value that you bring to the table. So the aim of this summit actually is to kickstart a discussion. I'm very much aware that there are so many groups in this country that are also beginning to do things like this, create awareness, and also to see what they can do in their own little corner to improve the health system. We want to encourage all such groups. We want to encourage individual professionals. We want to encourage the CMDs. We want to encourage all Nigerians. This is not the time to get angry and leave. This is the time for us to come together, work together, and fight for the health system of our collective dream. I want to thank you all for making time to be here with us this morning out of your busy schedule. I believe that this session will impact us greatly, and I want to encourage us that in whatever little corner you find yourself, please be the change that you desire to see in Nigeria. And I thank you all for all you do. The Lord will continue to bless you. Thank you.